Every year, the experts at U.S. News & World Report rank the nation's best hospitals. They've recognized St. Vincent as the #1 hospital in Arkansas and listed 8 clinical areas as high-performing specialties. The next closest Arkansas hospital only had 3. This recognition is due to the unwavering commitment of our world-class physicians, dedicated nurses, and associates who have now made St. Vincent the state's #1 hospital.
And no pain.
It's just a little tightness. It's kind of genetic. My great-grandmother, my grandmother, my mom, and my dad both have right knee problems, so it was hurting. In fact, Dr. Barnes said that my knees had rubbed grooves in each other from rubbing bone to bone. All I knew is that it's an implant, medication implant, that just like a pain reliever, and it lasts up to 72 hours after surgery. So during surgery, you get, all kinds of drugs and pain pills and stuff, and you're really not steady on your feet. You're subject to falls, and everything's hurting. Even though you're taking pain pills, it still hurts. With this, I've had no pain at all. It's just great. I mean, it's just like, in fact, coming in the hospital, the pain that I've had for months and years, but it's just a relief. And I know it's going to start hurting in 72 hours a little bit, but right now it's doing great. The things that I'm going through right now with the physical therapy is, getting it straight, and then getting it bent as far back as I can. And so I think I achieved all but 4 degrees of straightness a while ago, and I was 5 degrees beyond the bending. So I'm already ahead. So by the time I finish PT by Friday, hopefully the pain won't be that big of an issue. And even now, I mean, I'm able to eat. I had surgery at 7:10, 7:15 yesterday. I was awake in recovery at 9 o'clock. I had lunch, and I've been doing great since then. So it's like I wasn't in the hospital. People go through all kinds of pain, and like I said, they're unstable on their feet, and not only do they continue having the pain, but I guess it interferes with their getting better or getting out of the hospital quickly, because they don't feel like eating. They have nausea, from all the pain medication. So this is a way to avoid all that. It makes a better, happier experience of getting a knee replaced. You're fearing that when you come in here. And, the Joint Academy and Spine Academy is fantastic. That tells you what's going to happen. It's the old military adage, This way you're clear-headed, you're on top of it, and you should be able to PT or get past that hurdle. And I was kidding with Dr. Barnes this morning, if they could make it 6 days instead of 3, it would be fantastic, You could be almost ready to go out and run sprints,